I want everybody who has kids to listen up, because if you have snoring, bedtime battles, restless nights, why do so many kids struggle with sleep? And how can parents tell what's more than normal kid stuff?
If an adult stops breathing an average of 5 times per hour, that's noted as mild obstructive sleep apnea. For children, it's 1. There's a lot of people where they think, oh no, like my child might have ADHD. But then ultimately, no, it's just a sleep disorder like obstructive sleep apnea, snoring. Does that mean they have a sleep disorder? No, but it starts to ask those other questions. You are an advocate for your child. So if anything is going on for your mommometer or dadmometer, you bring it up.
Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hello, welcome to another episode. You know who I am, and guess who I brought. If you all are paying any attention to social media, you know it is Sleep Dr. Chris, live and on the show. This is his comeback episode, because guess what? Since the last time, you have a book, Sweet Dreams. We're going to go into what his book is about. It is super, super cute. But I want everybody who has kids to listen up, because if you have snoring, bedtime battles, restless nights, with your kids, what we're going to be talking about today is why do so many kids struggle with sleep, and how can parents tell what's more than normal kid stuff when they need to start thinking about getting that expert opinion. So if you don't know Sleep Dr. Chris, I find it hard to believe. He's literally has like 500,000 followers on Instagram. He is a double board certified sleep medicine physician. He's a pediatric neurologist and CEO of Quality Sleep and Neurology PC in Saginaw, Michigan. And I believe you work with your wife. Her expertise is in obesity medicine.
Right.
So you got the full gamut going on in Michigan. He is just an amazing superstar. I'm so excited to have you, Dr. Chris.
Well, Allison, thanks for letting me be here. And first of all, welcome back. Before we started, I was just telling you that, I come with my mind, how times have changed. A lot has happened between the last time I've been here. And I come with humbleness and gratefulness, because you were one of the podcasts that was on, initially. And so I'm forever grateful for that. And so it's been a roller coaster. It's been a ride. I've been able to, shameless plug, get my book, Sweet Dreams, out there. And it's very surreal. And I use that word a lot, but I really do mean it when I say it. Just to think that what has happened from the last time we were here, and how I even got my own personal story out there, adapted for a children's story, is really very special for me, because parents are going to read this story and they might be able to see something in their child. This might be at schools where teachers might see that in their students. And there's a guide. It's a great story. It's a personal story. And it's hard because you put something out there, it's being very vulnerable. It's wow, this is me. So if I put this out there, wow, I'm really telling this story. So I'm just very grateful just to be in this scenario.
He is doing a lot for sleep. I have learned so much from you on your journey. It really helps me keep the faith that what we are doing, this is really what we do because we're passionate about it. We still see patients. We fit a lot of the stuff that we do as an extracurricular, really. Anything we can do to raise public awareness. And the fact that we have the gift of gab and we don't mind sharing our opinions and being out there. And again, like you said, just the fact that we're talking about it, it's not easy when you get people saying nasty things to you just because they're in a bad mood and they just figure it's safe to do it on a social media platform. But as I like to say, if I got a hater, that means somebody's listening. All right. Even if you don't like it, that's okay.
It continues the engagement, and it pushes it out to people that actually need to hear it.
Absolutely.
At least that's what I tell myself. And I have to tell myself that before it's hold me back. So
I'm a Jersey girl. I mean, you poke me the right way and I'm like, mama's potty mouth has to go back in. And I get reminded of that by my kids often.
There's been times where I'm delete. I was I don't need to say that.
I know. Man, have I gotten myself in trouble with some emails? Don't we know it? Okay, so we're going to kick it off by talking about why sleep matters. So you often say that every child deserves a good night's sleep. I think we both are aligned with that. We want our all of our children to be sleeping well. Why do you think it is that sleep is so critical for a child's learning, their mood, and their growth?
Just like adults, it's more important to me, and I feel this personally in children, because those are, you hear that that's the formative years. Not only are you growing and you're learning, you need that restoration for it to happen. And so just to make sure that you're getting that quality sleep along with it, but not only that, that we're making sure that there's not a sleep disorder. Because if it is, that can decrease that formative years, as far as like IQ scores or mood changes or concerns for neurodivergence, because there's a lot of people where they think, oh no, like my child might have ADHD. But then ultimately, no, it's just a sleep disorder like obstructive sleep apnea. And finding that out, or even if they have neurodivergence, for example, if they are autistic or if they have autism, if they have ADHD, getting those quality sleep help your child with that. And that's one of the biggest reasons why I did that, the book, so I can tell not only my personal story, but to give those parents and that child a fighting chance.
So speaking of which, getting into your story a bit, what are some of the signs that people should be on the lookout that this is, listen, our kids all have some bad days. Sometimes they're fighting you about bedtime. There's a whole slew of reasons why that occurs. But what are some of the red flag signs that you want people to leave here today going, oh, maybe I should really think a little bit more deeply and take more seriously my child's sleep, that there might be something else going on beneath the surface?
That is a 4-part series, but I'll be able to sum it up for you. So in regards to like my personal story with the obstructive sleep apnea, because, it's different than it is in kids than it is from adults. Small kids, small airways. And so there can be things that could be obstructing it, like their tonsils. So I'm not saying that all children that have large tonsils, like they have a sleep disorder, but it starts to ask some of those questions because you know your child and you know when they need a nap or they're fighting bedtime. So if they feel like they are moody, see how they're sleeping. The first one is the simple one, snoring. Does that mean they have a sleep disorder? No, but it starts to ask those other questions. So like if they sleep with their mouth open, if their chin is up and they're extending their neck, those could be reasons why they have a sleep disorder like obstructive sleep apnea. If they're flip-flopping in their bed, those are reasons. And especially if it's hard for them to wake up, or like if you're driving to school and they're falling asleep in the car, those are all those reasons where a sleep disorder could be happening. And that's when that conversation starts, where you get to talk to their provider or see a sleep doctor like me.
Now, if they're going to bring this up, probably a lot of parents are going to start with a pediatrician. What would you want parents, what do you want them to flag? You mentioned snoring. You mentioned them being really sleepy in the car. Are there any buzzwords that you think a pediatrician might be more on high alert for? Or if the pediatrician seems to sort of poo-poo it, that you still push? Because I think that's the harder lift sometimes, is how we can improve communication and really kind of get people to not be like, oh, it's probably nothing. We hear that a lot, right?
Well, of course. And I am a sleep doctor. I see kids and adults, and all the children I see, I hear that story more times than I like to admit. And one of the things is that you are an advocate for your child. So if anything is going on for your mommometer or dadmometer, you bring it up. Those key words are, snoring, hyperactive, definitely pausing and breathing. You see that, they're not going to skirt that away. And even if you say like, well, this is fine, I'm telling you that it's not. And you can always say, well, can we just check to get that? Or if you feel like that's not fine, ask them like, when you write your note, put that in writing. Because when you hold a provider accountable, then we're like, oh, put it in writing. It's like, let's look, circle back and look at this, and you put it in there. And so it holds them accountable and it holds you accountable. And I tell that to my own patients. It's like, look, I want to tell you something. I'm always going to give you the why. And I have to put the why in the documentation as well. So if you feel like you're not being heard, look at it in the documentation. And if it's not in there, there's always other people that will listen. But of course, any parents that are listening, you're going to root for your child. You're going to be that advocate for them. And I'm very, very proud and very blessed where I have a lot of passionate parents that I get to talk to that want to make sure that their children feel well. And if anything, it charges me to make sure that I do my job to make sure that we find out if there's anything happening.
Can you talk to us a little bit about now they've sort of flagged it and they're like, hey, the sleep doctor's talking to me. I need to get this sleep study. Can you describe a little bit about what parents and kids might expect with that whole process? Because right now, kids, it's not really done in the home like it is for adults.
And it's funny, that's a good segue / shameless plug to why I made this book, Sweet Dreams. It's my personal story, but it's like that overview from a child's perspective of what they see for a sleep study, because most children have sleep studies in a sleep lab. So sometimes it might look like a hospital room. Most time it looks like a bedroom. It's a bed that you go in there and there's a couch for mom. And in that bed, you're going to lay down and they're going to have sensors on you to check your sleep. So there'll be a belt around your chest, a belt around your stomach. There'll be flow sensors under your nose to see how you're breathing, monitoring your oxygen to make sure if it's dipping down or not. And then there'll be sensors on your legs to see if your legs are moving while you're asleep as well. And then at the top, they're going to put like these limited EEG leads on your head so they can check what stage of sleep you're in. So that's what they have. And that's why I put that in the book, because one of the things I'm also doing when I'm promoting my book, I'm reading it at elementary schools. I'll have children raise their hand to say, hey, who's had a sleep study before? And so some of them will raise their hands. I do that to let them know that they're not alone. And then also I talk about it within the story so you can see like, wow, this is what actually happens. I only know about 2 other books that talks about like sleep and not as in depth with sleep apnea. And so that's one of the reasons why I made this book.
So necessary. And that is why I was like, I got to get you to come and talk about this. It's a really special. And it's so easy to read and fun. And it, like you said, you're being very vulnerable about sharing that. And I loved the caricature and the illustration kind of showing what that sleep study looks like. And I was like, I had this whole set of questions I was going to ask. And then I completely pivoted because I'm like, oh no, we can talk about way more fun stuff because this is stuff I have never broached on the show. So I'm so excited I have you. The criteria for kids versus adults in terms of what defines sleep apnea is different. So I was hoping maybe for anybody who's going to get a report for their kids, what are some of the numbers they might look at and how would you interpret that? Because kids can have way fewer events, but it could be more significant. So can you highlight that a little bit for our listeners?
No problem. And I think that's where it comes into when you have your provider telling you and guiding you through this, because again, obstructive sleep apnea is different than it is in kids than adults. So for example, if an adult stops breathing an average of 5 times per hour, that's noted as mild obstructive sleep apnea. For children, it's 1. So if we notice 1 event per hour in pausing and breathing, and then there's also extra criteria where not only do you look at the pausing and breathing, you can look at their carbon dioxide. And if it rises above a certain point for a percentage of that night, then that can also count as obstructive sleep apnea as well. So the numbers you look at is mild, moderate to severe. And the reason why we say mild, moderate to severe is not like, oh, it's mild, oh, it's moderate. It helps us realize what we're going to do for treatment for the obstructive sleep apnea. So for children, 1 event per hour, that's mild obstructive sleep apnea. When it's 5 to 9, that's moderate. And anything 10 and above is severe. And the funny part about that, and I really like to stress that, because in adults, moderate obstructive sleep apnea starts at 15. So if you heard the number, it's like, wait, I don't get it. Because it runs in family as well. And there can be an adult that's like, wait, but I stopped breathing 15 times an hour. And they're saying it's severe. My kid's only 10. Well, that's what it is for children. So it does have different numbers. And the cool thing about children, because they're still young, and I said it earlier, small kids, small airways. So the older they get up, the older they get, the airway's going to open up more, and there's a chance for the obstructive sleep apnea to even help resolve even more moving towards that. But again, we're dealing about formative years. So I'm not going to wait on treatment for a child if they are being effective. And that's one of the things that's cool about treating obstructive sleep apnea. There's more than one way. The biggest way for children, you can take out their tonsils and adenoids, and that can lead to resolution. One of the tips I'll give to parents And it depends. And this is the question you talk about the provider that you're with. A lot of people will do the treatment and then they'll ask me, I was like, hey, Dr. Allen, like, is it gone? The answer to that question is, I don't know. And so usually I'll get a study afterwards just to see how they're feeling symptomatically. But you want to get that study afterwards. And if they don't, I always encourage like families to ask the providers, like, well, why aren't we? Like, how do you know? Because there's nothing to guess with it.
I do have a question for you because this has taken me back to when I was a fellow, and there's so few pediatric sleep specialists that I have actually forayed into seeing kids a bit. Usually they're more in the teenage years. So it's a little different. But the bottom line is that I want to be open to seeing more patients simply because there is an unmet need. And I know a heck of a lot about sleep. Plus, guess who I have on speed dial? I've got friends. So if I have questions, I can ask. One of the things we did, and of course it was a very poor environment. We're talking about a county system in the Los Angeles healthcare system. So these are a lot of people that to get them to surgery may be a heavy lift. One of the things that we would do, or at least try, would be a nasal steroid to see if we could reduce the size of the tonsils just by doing something topical. Do you know anything about like the success rates? Is that something that you would try before surgery, or what kind of determines that utility? Or quite frankly, is that just something that you use in a resource poor environment?
When I tell people that there's more than one way to treat obstructive sleep apnea, that is one of the ways. So when you use that corticosteroid, most commonly like fluticasone, and one of the things that it will do, it'll shrink those tonsillar tissues. And we told you small airways, and those tonsils could be blocking it. And so using those nasal steroids can help with the tonsillar tissue, but more so also adenoidal tissue, which you can't see unless someone takes a little tube and stick it right down your nose to look at it. It does, it helps. And so I will do that for all my patients for a couple of reasons. One, you might be in an area, and sometimes this happens with me, where you're trying to see the ear, nose, and throat doctor to go forward with removing the tonsils and adenoids, but they might have a long wait list. So I'm not going to tell the parents, like, well, they have sleep apnea, so you got to wait 3 months. Like, but you just told me all these bad things. And so that's why I always say, like, you know what, let's start them on a treatment, and that can help along the way with it. And they might have some other parents that might have some hesitance to want to go in to do that procedure. And so there's another way. So you can do that as well. There's something that's called rapid maxillary expansion, where it literally opens up the airway. So there's different ways to do that. I use my orthodontic and dental colleagues to help along with that as well. So there's many ways.
Is that a MARPE for short, or is that different?
No, that is a little bit different.
Okay.
But the rapid maxillary expansion, because when you're younger and the kids, the structure and your airway is still forming, you can help like with the bridge open up like just a little bit more compared to like with the MARPE with adults. Usually it's used in old patients where that's like a different scenario that you would use for children. But going back to the fact that there's more than one way to treat obstructive sleep apnea, even CPAP therapy, you have continuous positive airway pressure. That last word is the most important part. You provide pressure to keep that airway open. I've had patients as young as 4 years of age that was able to use it and use it well. Now, you know your child, so sometimes it might work and it might not, because there might be options where if you have a sleep study and you go to the ear, nose, and throat doctor and they're saying, I'm sorry, well, they're not a candidate to take out their tonsils and adenoids. I don't think this is it. And so I'm not going to tell the patients and the family to say, well, sorry, they said they can't treat it, so thanks for coming. There's other ways to treat it. And CPAP therapy is awesome. And one of the things I like about that, again, the older you get, your airway is going to open up more. And so I'll keep them on CPAP therapy. And if they're doing well, then we'll retest when they get a little bit older to see if their obstructive sleep apnea has been treated.
And are there certain things that you look for to say, you know what, I'm going to go straight to CPAP? Would that be your AHI over 10, for example, that severe patient, for example, kind of like how we do in adults? I'm curious.
You know, it's funny. The biggest thing that goes back to like in our fellow days where they had this large trial, the chat study, where you see when should you like either take out the tonsils and adenoids, or you can do a watch and wait. And so with mild to moderate, when it's mild obstructive sleep apnea, if they're not as symptomatic, you can choose to wait. And there are some people that will do that. There's studies to show that as well. But for moderate to severe, there's the conversation where like we could wait or we can take out the tonsils and adenoids. But then usually severe, I will move forward to take out the tonsils and adenoids from it. So if it's severe, I'll still do tonsils and adenoids because it's different from having CPAP therapy because that's treating it as long as you use CPAP therapy. So if they are a candidate where they can take the tonsils and adenoids, it can lead to resolution. So I would rather want resolution for that. And of course, it's a conversation with the family members. So there's some times where if I might go straight to CPAP therapy, it's usually after the fact because they had severe obstructive sleep apnea. They got treated with the adenotonsillectomy, taking out the tonsils and the adenoids. And they would do another study and like, they still have obstructive sleep apnea. So we still need to find a way, again, CPAP therapy, CPAP, that P for pressure is going to open up their airway more to help.
Do you ever find, like, in terms of insurance, this is a super practical, boring question, but I think relevant, because especially since, sleep care can be expensive if you don't have good coverage for it. Can you do CPAP as that bridge before the tonsils and adenoids and have that be covered? Or do you typically do this topical steroid, the TNA, and then wait for CPAP?
Normally, what I usually do, because everything is still time, and even with the sleep study, there are some centers where you still wait. So you're waiting 2 months for the sleep study, 3 months to see the ear, nose, and throat doctor. So what I usually do is like the nasal steroids to see if that helps a long time. Because even though we talk about all the things that can happen when people don't treat their obstructive sleep apnea, you still have, that happens over a period of time. So using the nasal steroids are helpful. And one of the things that I love about children, they are, well, at least for sleep apnea, very rare will they not approve a study for children. So if they won't have a pushback, and I'm not saying 100% of the time, because there has been times I'm like, look, this is a 7-year-old kid. You're telling me you want me to put him on auto CPAP therapy, which is not clinically
Do they even
indicated?
do that?
Well, no, you can't.
That sounds crazy.
It sounds like it's a cut and paste system. That's what happens. And so when I usually talk to somebody, by that time it's like, oh, well, and then, they don't want to say that, but then they'll get it covered. If it takes a while or if there's an adverse reaction for them to use the nasal steroid with Flonase or fluticasone, then I would potentially do CPAP therapy to help along with that. But it's really good at getting them in there. And rarely I have that case happens. And it does take time. That's the hardest part with children because it's like getting to the doctor, finding. So that's why I put this book out here. It's just so you can see those symptoms so you can get that quicker and know what you are looking forward to going along that process.
You are pointing out something that we have an issue with across a lot of different sleep disorders is the time to diagnosis. What was your personal experience with the time to diagnosis? Did it take a while to recognize it and get you flagged and tested?
And so that's why the story is based on my personal story, because my personal story, I didn't find out about it until I was sitting in medical school and they were talking about obstructive sleep apnea. And even then I was like, that's not me, because my friends were telling me that it was. And that's why I decided, if I'm going to tell my personal story, I want to tell it from a kid's perspective. So everything in the book is true about what happened with me. So throughout my life, I was the kid that was falling asleep in class or on long car rides or being inattentive, thinking that could potentially be ADHD, snoring, and not having people want to share rooms with me because I would snore. And so that's why the conversation happens. And you said we have the gift of gab and we love to talk. We love to talk about this because it's really important because knowledge is power. And when you read something, you're like, wait a second, I see that in my child, or I saw that in myself when I was a child. And that's why I made that story from that age, because I want to make sure that no child goes through what I have.
Thank you so much for sharing your story, for being brave, for being such a wealth of knowledge in such an accessible way. I want to ask you one final question, which is, what's one thing you'd want parents to do tonight to make sleep for their child easier?
1A, get the book. It's a nice story. But outside of that, to help with children going to bed, and I know we've talked about obstructive sleep apnea a lot. There's 2 things you do when you're sleeping. Just look to see how they're sleeping. If they're snoring or pausing and breathing, if they're sleeping with their neck arched, Those are things to look at where bring it up to their pediatrician or their primary provider. That's going to be helpful. And then also knowing when bedtime doesn't start at bedtime. Bedtime starts 1 to 2 hours before. So help with that wind down time. And if they are having those moments where they're against going to bed, I don't want to go to bed, that can help it. And if it doesn't, I have 4 words for you.
I love it. To my listeners, if you walked away from this episode having learned even one thing, please like, comment, and share this episode with someone who needs to hear it. Thank you so much, Dr. Chris. You're amazing. I can't wait to see you at Sleep. It's a pleasure, always.
Always. Till next time.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.